So thank you very much once again, Kitty, for the warm introduction. So again, my name is Lawrence, and today I'm going to talk about age-friendly community interventions in the Philippines from the ground up. Now, this will be the outline of my study. So first would be about age-friendly community interventions, and of course the different environments, enablers, and facilitators. I'm going to focus more on the Philippines and its goal to establish age-friendly environments and communities, being a low and middle income country in Southeast Asia, and some lessons or insights into developing innovative yet age-friendly community interventions. So I'm going to focus on the development and pilot testing of an integrated and low-cost motor cognitive intervention for community-dwelling people with mild cognitive impairment. Now, age-friendly environments or cities or communities is not a new term. It was originally coined way back 2007 by the WHO, but in its latest guideline as of 2023, well, these could refer to homes, cities, or communities that foster two basic concepts. The first one would be intrinsic capacity, which involves the social, mental, and physical capacities of older people throughout the life course, which will enable them to have functional ability or the ability to live independently within that given capacity. Now, this is very important, and this is part of the United Nations goals on the decade of healthy aging, because this would give the older person several advantages and benefits, such as that your person-centered and integrated care in the community, especially in primary care. What else? Improved integration of health and social care in the community, and of course, the concept of aging in place, wherein we enable older adults to live independently and comfortably in whatever home, community, or setting they choose to. Long-term care, definitely, and of course, informal to support the informal carers as well. Now, when we talk about age-friendly communities or environments, now the WHO has given us 8 domains to determine the friendliness of a city or a community. So it can be subdivided into three types of environments. The first one would be a social environment wherein there is civic participation and employment. There would be respect and social inclusion and social participation. Another one would be the service environment, wherein there would be community support and health services, as well as communication and information structures. And the last one would be the built environment, involving outdoor spaces and buildings, transportation, and housing. So, meaning it's beyond the person. We have to also go to the, or we also have to consider the social and ecological factors into ensuring that a community or a city is friendly to the independent living and, of course, functional living of our older people as well. Now, the WHO last 2023 recently released the national framework wherein it will guide the national programs for age-friendly cities and communities. And it gave us 6 basic steps on how to establish age-friendly communities. Now, the first one would involve partnerships, networking among stakeholders, leadership and strategic thinking, pooling of appropriate resources, capacitating our human resources, and of course, continuous collaboration with different agencies to ensure innovative practices, and of course, monitoring and evaluation. As simple as it may sound, it will take several months to years for such goal to be realized, especially for low resource settings or low and middle income countries. So the Philippines being one of those, I'll be putting a special focus in this country. So the Philippines quest towards age friendliness. But before we proceed to such, let me just give you a picture of the Philippines. Now, here the older people population would comprise almost 10% of the national population. So the statistics would say that around 2030 we can basically be considered an aging population, and a majority of our older adults basically live inside the households because it's considered to be a mortal sin if they will be sent to nursing homes or residential care facilities. That's why a little 0.2% are only admitted into institutions or residential care facilities. Having said that, a significant majority of older people in the country have only completed basic education in terms of primary and secondary level. In terms of the socioeconomic independence, unfortunately, it's not a good picture because 73% are still fully or partially dependent on their children, and 55% of health expenditures are out of pocket expenses. Despite nonetheless, there is already efforts or initiatives because of the universal health care. And we only have four public residential care facilities across the whole country because, again, it's not considered one of the priorities compared to other developed countries. Now, recently, the Philippine Plan of Actions for Senior Citizens, here in the Philippines, we often call older people our senior citizens. So that's why it is called as such. There has been a recent interest about establishing age-friendly environments, and it's one of the KRAs or key result areas, and that is to develop age-friendly cities and communities. So one of the target outcomes for that would be to promote physical, emotional, and social environments that would allow the senior citizens to continuously thrive and develop and maintain functional ability that will enable well-being in old age. So this includes the development, implementation, and evaluation of age-friendly community interventions to support the well-being and functional ability of our older people, or as we call them, our senior citizens. So in the literature, it was prominent that implementing the framework from the WHO in low resource settings could have certain challenges, obviously because of certain financial, technological, and human resource limitations. Now, a systematic review by a colleague and friend, Jed Montaire et al. In 2022, so they revealed that rural age-friendly interventions they should be tailored to the existing strengths of the community rather than using a macro level approach, which are usually based among the best models, which are from high income or fully developed countries. Now, in another review, it was revealed that the most successful age-friendly community interventions they utilize partnership models or co-design in their development and implementation, and as well as social participation and engagement, because it gave the community a sense of ownership and accountability, and a sense of collaboration that we are actually part of the program. And most age-friendly community interventions were noted to involve physical activity and exercise interventions, apart from health education, aside from multi-domain interventions, which are very important because if we want to develop the intrinsic capacity of our older people, they should be covering the physical, social, and cognitive well-being of older people as well. Now, I'm going to focus on this particular research with a gap that cognitive impairment is more common among low middle income countries. However, useful interventions are lacking. And while there were previous interventions, most of them were resource intensive, involving technological tools, healthcare providers, and advanced exercise equipment, which are not readily available in low resource settings. Now, an innovative, an integrated, and inexpensive means to promote a multi-domain benefit for older adults would be the cognitive enrichment of physical activities, which is called dual task training. So here I'm going to present this development and pilot testing of the intervention known as dual task Zumba Gold to improve the cognition and other outcomes among older people with mild cognitive impairment. And to the best of our knowledge, this is, if not the first, one of the first studies published that use a dance-based dual task intervention for people with MCI. You might be wondering why Zumba. The Zumba is a very popular dance here in the Philippines. It's actually present in 180 countries all over the world. And although it has its Latin roots, it was embraced by the Philippines because of our rich Hispanic influence, since we were invaded by the Spanish for more than 300 years. But more than that, The international benefit of this one could be enlarged because of its presence across several countries all over. Now, the study mainly focused on developing an integrated motor cognitive intervention to improve the cognition of people. Aside from that, we tested its feasibility and preliminary efficacy among people with STI. So this was composed of three phases. The phase one involved a systematic review to mainly develop the protocol, but we also included qualitative consultations with our target stakeholders. That will be the older people. After refining and of course expert consultation as well, with the intervention protocol, we subjected it to feasibility testing among a small number, around 10 participants, to determine if they would be able to fully participate in this novel intervention. And the last one involved a pilot trial to determine the preliminary efficacy of this intervention. Now we go straight to the stakeholder consultation because this is one of the highlights of the study. So, after developing an initial intervention protocol, we conducted focus groups and in-depth interviews among 44 older adults, and they have provided significant insights on how to make sure that the intervention would be tailored for their needs. So that involves having pre-implementation sessions, providing social interactions during the intervention, tailoring activities, task repetition, and progression, having adequate rest to prevent or minimize mental and physical fatigue, what is the appropriate duration of the session, and focusing on the environment, they highlighted the importance of having an outdoor setting compared to what is being done in other countries or compared to what is being present in the literature, wherein most of these will involve dance studios or enclosed gymnasium. So here in the Philippines, most Filipinos would usually prefer to exercise or conduct their physical activity sessions outdoor because it gives them a better sense of community and they have a better sense of the environment where they are. And it's more inviting as well for others to join when they see other people having fun or enjoyment. Now, as an offshoot of this qualitative study, we were able to refine the protocol and then we tested it among 10 people with a mild cognitive impairment, which provided promising results in terms of feasibility with good retention, adherence, and implementation fidelity as well. So, fortunately, there were no adverse events as well, and there was good intervention acceptability among the 10 participants. So, it was a mixed method study, so they provided qualitative inputs as well on how to further improve the intervention protocol before its pilot testing in the last phase. So the last one involved a pilot RCT, wherein we involved 60 people with MCI, which were randomly assigned to the intervention and to the control group. Now, these are people with MCI based on the Peterson criteria, which is one of the standard means of determining mild cognitive impairment among older people. So the following are the inclusion criteria. Well, meanwhile, the control group involved health education with a self-monitored physical activity. We tried it to be as equivalent as the duration or the dose rather of the intervention. Now, this is the intervention group or the exercise itself. It was thrice a week for 60 minutes, and it lasted for 12 weeks. It was facilitated by a licensed Zumba Gold instructor, which was instructed by yours truly and two trained assistants as well. So there were 10 participants per session. It was done in a covered outdoor community gym, wherein there was adequate space for the 10 participants to mingle and of course to participate well during the session. This is a summary of the intervention of the session protocol. So it lasted for 60 minutes, and the first few minutes for 10 minutes involved a warm up session. But as you can see in the cognitive component, it involved several cognitive domains, such as the first one would be attention with orientation as the first domain that we tested by asking questions to determine the orientation of participants in terms of time, place, and person. That was followed by the actual Zumba Gold dance, wherein it was characterized or incorporated with four cognitive domains, such as executive function and calculation, wherein serial counting forward and backward was tested perceptual motor and visual-spatial ability, wherein participants were asked to demonstrate arm clock positions using both of their arms, depending on the visual or the auditory cue provided by the facilitator. Memory by asking them to repeat several number or word series, forward and backward, and attention using simple spelling words of local animals in a progressive manner. So the exercise or the cognitive tasks basically progressed every 4 weeks with group and individual performance. This was followed by a cool down session, which lasted for 10 minutes, involving recall of activities that they have performed. So the primary outcome of the study was the global cognition of the participants. This was tested by MOCA. Meanwhile, the following secondary outcomes were tested. So some of them involved specific cognitive domains, psychosocial outcomes such as quality of life and depressive symptoms, and physical outcomes such as mobility and bodily measures, non-invasive bodily measures. We also gathered post-intervention feedback qualitatively to determine their experiences after the intervention. And of course, we collected data into 3 time points: pre-test, post-test, and 6 week model, which were analyzed by a GEE or generalized estimating equations. Now, the post-intervention feedback were gathered using qualitative data. Were analyzed rather using content analysis. Now, in the interest of time, I will just be posting the summary of the results. So there were significant improvements at post-test and at follow-up in terms of global cognition, executive function, immediate and delayed recall, quality of life, as well as mobility. However, for the other aspects, working memory, depressive symptoms and blood pressure, waist circumference, and body mass index, there were no significant improvements noted. Well, the possible reasons for this one were possibly they would require a longer intervention period and the possibility of ceiling effects as the baseline measures of the participants were not that low compared to the other studies that found significant findings. So for the retention rate, it was relatively high at 83%. It was well attended as well. A good implementation fidelity and acceptability, and consistent with the feasibility study, there were no adverse events reported. So this is a summary of the post-intervention feedback or interviews. So to summarize them, they basically said that this is a feasible and a beneficial program with multi-domain benefits, and it can be done by older people. Yeah, even those with MCI. However, there could be possible barriers and challenges in performing such activities. Nonetheless, they were able to point out what are the possible enablers or facilitators and even future recommendations in the next sessions or the next edition of the program. So the key study findings are the following. Number one, this intervention could be a potentially feasible and acceptable program among older people with MCI, and it has the ability or the potential rather to improve global cognition and several cognitive subdomains and psychosocial outcomes such as quality of life and physical outcomes such as mobility. However, the other secondary outcomes were not confirmed, and thus a future RCT with a larger sample size and a longer follow-up period would be imperative. So based on our computation, it would be around 116 participants, at least in the full-scale RCT. Now, what are the study implications? Well, number one, it's a platform. It could be, the Zumba Gold could serve as a platform for dual task training, in innovative strategy as well for physical and cognitive training. It has the potential to train more instructors because it is practiced in 180 countries. Thus, it could be applicable to other cultures or settings. And it also has the potential to be incorporated in health promotion programs in the community and even possibly in residential care facilities as well. And ultimately, it could serve as a launching pad for future studies on using other aerobic dances, not only Zumba Go, as a dual task approach. And this could definitely benefit large populations of people with mild cognitive impairment. Now, to end this session, I would like to show the following insights. What's the way forward among age-friendly community interventions? So number one, there is a need for a comprehensive stakeholder consultation. As we have mentioned, there's a sense of collaboration, ownership, and accountability, and this will promote engagement and sustainability among age-friendly community interventions. Thus, a participatory and multi-sectoral approach would be crucial. Number two, the current literature is dominated by person-centered approaches, and there is a need definitely to integrate the environment-focused programs because, as we have mentioned earlier, there are 8 domains. So it has to be an integrated framework. And finally, there is a need to adopt the WHO framework. However, we must still emphasize on the bottom-up approach. Everything has to be evidence-based, but we have to consider what are the resources and possible limitations so that we could be able to deliver the best age-friendly community interventions to our stakeholders. So I think these are the references, and that will be the end of my presentation. Thank you. In our language, maraming salamat.